Hi, my name is Natasha Tracy. Thank you for joining the HealthyPlace Facebook Live. The topic of today's show is Depression Almost Killed Me, My Comeback Story. Before we start, I do want to let you know we are looking for your questions and comments. So type them in the chat box and we will get to those shortly. Now, one thing that many people don't realize is just how dangerous undiagnosed and untreated depression can be. In 2017, our guest attempted suicide and was immediately hospitalized. It was there that Jennifer Smith was diagnosed with major depression. She's joining us today to not only talk about these dark days, but also how she learned to cope with depression. Jennifer is actually the former author of the Coping with Depression blog at HealthyPlace.com. She's also the author of the book Mountains and Melancholy, a collection of poems about life and life with depression. Jennifer, welcome.
Hey, it's good to see you.
Nice to see you too. So before that suicide attempt, what was going on in your life?
Immediately leading up to it, I was having to cope with my daughter. My youngest child has significant special needs, and she was getting older and it was getting harder. And prior to that, I mean, as far back as what I can remember, I had always struggled with depression. I just did not know what it was. And growing up, in the 80s, it wasn't really talked about a lot. So I just thought this is just the way I am and I just have to deal with it. But then, all of that, struggle with my daughter and then some other things that I was going through just really culminated in it getting to the point that it did, where I did almost take my own life.
I'm sorry about my cat. He insists on making his debut. I'm sorry.
Yes.
So my apologies. You were in a psychiatric unit when you were diagnosed with major depression. So what went through your mind when the doctor told you that?
Once I got over I don't even know how to really describe how it felt going in there. I was so confused and just lost, really. But when I actually received a diagnosis, I felt relieved because it gave me an answer to what I had been struggling with. And I could finally say, okay, this is what it is. And so what can I do about it instead of staying unaware like I was and trying to just fight on my own, which is, a lot of people who have depression would probably, agree that you can't really just fight it. You can't snap out of it. So to have that support and to have an answer, it was very relieving to me.
If you are just joining us, welcome to the HealthyPlace Facebook Live. We are talking to Jennifer Smith, not only about surviving depression and how to cope with it and have a better life. If you have a question, please type it in the chat box and we will get to it shortly. We are also looking for your comments. How has depression affected you? Do you have one depression coping tool that you'd like to tell other people about? Let us know and we will share your comments as we go. So, Jennifer, back to you.
Mm-hmm.
Before we get to what has helped you with depression, there's a lot of stigma and challenges around being a survivor of a suicide attempt. Has any of this affected you?
It did. When it first happened, I did have a couple of friends who actually came during visiting hours to see me during the week that I was in patient care. And then some of the friends I had, I'll use that term loosely, stuck by me and still are with me. But, to be honest, I did lose some people who I thought were friends. But, and I've had, since I am so open about, my struggle and, I share that. And then of course, I used to write, for HealthyPlace. There have been people who, even online that I don't even know, have said some terrible things, about what depression is and just all kinds of, like you said, stigmatizing things. So it has affected me. But I found new people and then faithful friends that did stay with me. And then I've also been able to talk with and listen to other people who struggle with depression, because they know that they can be comfortable, and I won't be, judgmental, or I'll, to some degree, as much as one person can really understand another, understand what they're experiencing. So I would say that the good parts of, the tragedy have outweighed any of the stigma. So, I'll let those people go gladly.
Well, we did get one comment, and I guess someone told Walt to just stop being lazy. So is that something that you heard about not being lazy?
Yes. Yes. There were a couple of people who were like, what do you mean you can't just get up and, clean this up, and you can't do this, and what do you mean? Just get up and do it. On days where I'd struggle to get out of the bed, just get up, just go, find something to do. I got that too. So yes, I have heard that, and that is a stigma, because people with depression are not lazy. I mean, it's just like, it's physically, it's mentally, it's a health condition. And so there are days where, a person with depression may struggle to get out of bed or take a shower. It's not that they don't want to, it's not that they're lazy, it's just really that they can't. They're spending, I would, say, a lot of energy sometimes on just staying alive. And when your brain is trying to fight against you, that is exhausting in and of itself. So yes.
We actually got a question. Sorry about that. Didn't mean to cut you off there.
No, that's fine.
We actually got a question from Corrine. Did you blame yourself for not being quote unquote normal?
I did. I did. When I didn't know that I had depression, I thought, why can't I just be like everybody else? Why is there always this negative internal dialogue going on inside of me? Why, when I had been looking forward to going somewhere, when it got time to go there, I was like, I don't want to go. I just feel like I can't go. Yes, absolutely.
So you're 44 now and 3 years out from your initial diagnosis. I know you never asked
45 now.
Oh, sorry. Okay.
Yeah, 45. Yeah.
Well, congratulations.
Yeah.
So
Thank you.
What is it like for you living with depression now?
Now it is, because of the coping skills that I learned through therapy, and because, not everybody does have to take antidepressants, but some people do. I'm one of those people, that does. So having those things to help me, it has made a big difference for me. And the way that my depression is, I don't think that I would have been able to practice coping skills without having been on the antidepressants, because that helped my mind to get to a place where I could think logically, because I wasn't, of course, when I was wanting to die, I just wanted to end all of this and thought that was the best way. So once my antidepressants became effective, and then I could think straight, the coping skills have helped me a lot, which is not to say that, depression is gone. It's not. It's here, but I'm more aware of it now, more aware of the things that trigger me. I have the coping skills in place, because there was recently, and I can't recall what happened, but somebody said something to me that I don't even remember what it was now, but it was something where I started having that old internal dialogue of, well, you just messed that up. You're just dumb. Why are you even trying? Why are you even trying to do anything? Who do you think you're fooling? And then I was like, no, nope. And practice that coping skill of not trying to even talk myself out of it, but just to say, no, nope, not today. And just went on about what I was doing. So, I have been able to do that more regularly. And I still see my psychiatrist, it's out to like once every 6 months now, but initially it was every 2 weeks, every month, every 3 months. And then I went through a particular hard time, probably a year and a half ago, and saw him more regularly. So I've learned to speak up about it too. Now that I know what it is, I can say, even to my family, to my close friends, I'm having a hard day today. I'm struggling, and they're very helpful about that, and being encouraging, or if I need some time alone, just to let me have it.
We do have a comment from Tracy who said that other things that people have said, I guess, to her, stop feeling sorry for yourself. And then someone else said to Teresa, people asked Teresa, how did you go through with the attempt when you have kids? So do you have a thought about that? Like if someone said that to you, how would, like the stigma of that, how would you deal with it?
Right. So about, the ones that say stuff to you, you had kids. At that point, I know for me, and I'm not sure if it's true, in her situation, but for me, I literally thought my kids would be better off without me anyway. I thought somebody else that didn't have the struggles I did could come in and do a better job. So, I mean, a person who is at that point is not a person who is thinking thoughts. They want the pain and the suffering to end, and they don't see another way out. And your brain does these things to you and tells you these things, like your children will be better off with somebody else. And so it's not like you're thinking straight to say, I can't do this because of this or that. It's just wanting to end that pain. And I forgot what the first question was before.
Just another comment. And so we do actually have another comment asking specifically from Alice. How has the stigma of the suicide attempt affected you, and what have people specifically said? That you said that people said things to you that were awful, and if you don't want to talk about it, that's totally okay.
I will. I will. Yeah, I'll talk about it. I had some people who said that I just needed to pray, or I just needed to go to church, or I just needed to read my Bible. I even had people, and I was like, what country are we living in? Say that my depression was caused by demons. And I was like, okay, okay. No way. Just go on. So yeah, that was some of the things, those were some of the things that got said to me. And I mean, it did affect me somewhat. And as far as I did lose those people, but I really chose to, I was like, and just, and just because you choose to cut toxic people out of your life doesn't mean that it doesn't hurt, because it does. So I did experience some pain and some loss, but looking at it now, I know that I'm better off without them. So those were some of the things that people said. Or, you don't need those antidepressants. You can just take this vitamin and this essential oil. And I'm not saying there's anything wrong with those things, because I do use, those too. But, trying to say that, exercise will cure my depression. That's some of the other things that I dealt with also.
Well, we had a few technical difficulties. So I'm Kelly, and if you don't, I'll go ahead and ask you some other questions.
Okay.
Monica says, they say that once you attempt suicide, there's a chance you'll do it again. Do you or other family members worry about that?
I would say that my family still worries about that. I did worry about it more up until probably a year and a half ago, I don't feel like I would do that again. However, I know that that could change. So I just stay very aware of it. Like I said earlier, about practicing my coping skills and being aware, because I had to learn how to recognize, when something had triggered me or when particular things were going to be happening in my life. Like even for today, for example, I know talking about this again can be difficult for me. I do it and I still, but I had to plan ahead and say, okay, after I do that, I'm going to go watch something on Netflix that I've really been wanting to watch, and I'm going to drink some tea or coffee and I'm going to just relax. And, last night with my family, we watched a funny movie. So just being aware, and I have to be diligent because, a suicide attempt is not something that, we can guarantee we won't get to the point of feeling that way again. We just have to put things into practice. And, certainly our family, will feel that for us. I mean, there are times I have to, when I'm talking to my family, like some people who are over, they're like, y'all got dark senses of humor or y'all got what, but I mean, that's how we cope with,
Yeah.
my depression and my daughter who has significant special needs. But, I will tell my family, I'm struggling today, but I am not suicidal today. And if I do have days where even if it's just a fleeting thought of, I'll just be better off, I'll tell them I'm having some fleeting thoughts, but I'm not actively, suicidal, because there's a difference in having some thoughts and some ideations versus actually being there. And I'm also very honest with my psychiatrist. He's really wonderful. So I can call him if I need to. And so I've learned where previously I might have hidden things from doctors. I don't do that anymore, and especially not from my psychiatrist at all. So I think just being open and honest, which can be hard to do because of stigma. And so we just have to open up, and that the people who are there for us care deeply for us, and the ones who don't, as painful as it is, sometimes you just have to let them go. And it's especially hard if it's your family.
Thank you for all of that information. I just want to wrap this up. I know there are a lot of people watching this video right now, and I just want to see, is there anything else that you do to cope with depression that you think people should know about?
Besides taking, my antidepressants, being open and honest, practicing my coping skills, self-care is very important. And, it's not just taking a shower. Those things are important. Sometimes you have days where you can't, but self-care is more like I'm talking about just things that you plan for yourself, like watching a movie, reading a book. And I know a lot of times when you do have depression, you don't want to do anything, but sometimes if you can just take a small step like that, just do one small thing, or have one small thing that you are looking forward to, just try to put those things in place also.
Well, thank you so much. Thank you, Jennifer, for coming on today. There is
Thank
no
you.
doubt in my mind that you have helped so many people today for your openness and honesty. So our next guest is Emily Roberts. Emily is an intensively trained dialectical behavior therapist, mental health expert, and media contributor. She has extensive experience working with major depression, mood disorders, trauma, and eating disorders. You can find her at theguidancegirl.com. Thanks for being with us, Emily.
Hi, how are you?
Great. So I just want to share a couple of comments. So Karen says that she exercises sometimes when it's really bad. So that's a coping technique someone might want to try. And then there's another commenter who asks about what to do when someone bothers you about antidepressants. So why don't we start there? Do you have a thought about that?
I would be curious to know, are they bothering about taking them? Or are they bothering them because they take them? I think that if there's noise in that area where people are you feel judged for your treatment. Like those are the people that Jennifer was talking about that are kind of hard to not listen to, but they're not your treatment providers, right? And if you're with a treatment
Right.
provider that you're feeling judged by, I encourage people to look for other treatment providers, because that's not how I want any of my clients to feel. And it can be really scary to find another treatment provider, but there are a lot of people out there who want to listen and want to know if medication is working, or if maybe it's not working. It's not your fault. It just could be the wrong combination of things. And so I think that treatment, unless they're part of your treatment team and you feel comfortable and supported by them, just do this.
So you heard Jennifer discussing her suicide attempt. Maybe you could share 2 or 3 challenges that survivors of a suicide attempt face.
Well, Jennifer's story is she did such a great job of explaining it in steps. She saw, and I want to go back to your question too, but the reason I bring this up, because the challenge is it's not like she went to the hospital and then the next day felt better. She started seeing her psychiatrist and therapist, and she gained coping skills. This took time, and that can be really frustrating to people around us, our family members, and ourselves. And so that's one of the biggest struggles, is we have to be patient and consistent with the course of treatment, and look how effective it's been for Jennifer. Her ability to cope ahead now, her ability to notice her triggers and use coping skills, and get rid of areas of her life, friends, family members, maybe not rid of, but, kind of put a wall up and boundaries up. Those are really hard things that all of us struggle with, and she's been able to do over time. And noticing her stressors. So one of the biggest hurdles I find with people who are coming out of a situation similar to Jennifer's is we want other people to understand, and they're not always going to understand. And that's okay, because you're going to find the people that will. And treatments don't always work as we say they're going to. So, for example, I've been trained in several different approaches, lots of different approaches, and one size of treatment doesn't fit all. So maybe you find a provider that you like at the beginning, and it's not necessarily working as effectively as you want it to. It's okay to have those conversations with your providers. It's okay to say, I don't feel good. But we want to know, actually, when you're not feeling the way you were feeling previously. So not one treatment is the perfect treatment. It's not true. I think that we need to be willing to see what's out there and learn to find people who we want to work with, who are willing to help us find those treatment modalities as well.
So I know you're highly trained in this. So what type of therapy would you recommend for people who have survived a suicide attempt?
So dialectical behavior therapy is like a cousin of cognitive behavioral therapy. They're really good friends too. And I say this because it helps us challenge and change the behaviors and and then that way we can change our thoughts. But the one thing I really love about DBT is it comes with a lot of support. Dialectical behavior therapy does psychoeducation, but also provides coaching, provides skills training for family members, for the client, for other people, and coaching. So when there's a difficult time coming up and your skills aren't working, or you're not feeling like they're effective, or it's hard and you need some extra support, that's when you can rely on your skills trainer or your therapist, or even your peers in that area to help you through it. And so I think that there's a lot of great talk therapies out there too. One of the things that I've seen to be most effective with the treatment of depression, and I say treatment, and I mean this can be a lifelong battle for many people. And so we have to be patient, and we have to be willing to find people providers especially, or treatments especially, that are willing to go the course with us. This is not a solution-focused, quick 8-session thing. No. DBT is often a great treatment because it does covered by insurance often, and there's wraparound treatment. This is not like you just leave the hospital and you're done. No, you're going to groups, you're in contact with your therapist. There's a lot that can be offered to help you feel better and supported when times get tough and when times are okay.
So I've got another comment here from Daniel. It says, I'm 42, married, have 2 wonderful kids, and I'm very depressed, but I'm afraid to tell anyone because I could lose my job and my marriage. So I pretend, and it's very hard. Do you have any advice for Daniel?
To find some support in his community, and you might know better than I do, depending on the situation here, but the job cannot fire you for having depression. If they do, that's like a no-no. And there's a lot of resources out there, but I'm sorry that you're feeling this way, that you feel isolated. And I know that there's a lot of treatment providers out there who would be willing to talk to you. You can do it without your family knowing if you want to at first, because I do think we have to remember it's very vulnerable to tell the people around you, especially if in the past, maybe they've been on high alert and always checking in. It can really be too much sometimes. So reaching out to somebody independently, a treatment provider, somebody who, even your general practitioner, if you feel trustworthy talking to them, somebody in your community who's got education in mental health, doing that for yourself and then figuring out how to express it with your family is generally a great course of action if you're feeling too worried in some ways about how they will react. And at the same time, if your family has been supportive in the past, it's likely they'll be supportive too in this situation. So sometimes that's helpful when we have a therapist who's by our side to talk to our family with us. Or virtually by our side. And sometimes, and they can help be the educator too for the family and help them learn how they can help you. So it doesn't have to all come from you. So I really hope that you do seek out some guidance and support, because you deserve that for sure.
And finally, if a person has attempted suicide and they're scared that something like that might happen again, do you have any advice for a person like that?
Reach out to your support systems. And I say that because maybe it's a therapist you saw 5 years ago, maybe it's a psychiatrist or a primary care doctor that you saw a while ago. They're still thinking about you and they want to help you. We want to help you. So even if we're not your therapist right now, we can provide you with some support or find somebody to support you or get you in the right direction. And don't give up on that. Like, it's okay to have these waves. It's okay to have these thoughts. And what Jennifer said that was so important was, just because you're having these thoughts doesn't mean you're having these actions. And so being able to recognize when you're having those thoughts and say, I don't like the way this feels, I need to reach out to those safe people in my life or those safe avenues. Do that before it gets too intense, if you can, because we really are here to help you, and we want to get you to a place where you can receive our support too. So if things are kind of trickling in and you're noticing patterns of old behavior, or like Jennifer said so eloquently, which was, I noticed that voice, I noticed it was coming in stronger. And I was like, no, she did such a great job of expressing that, because it can come in subtly, but it also can take over. So when you're noticing this, please reach back out to your providers. We are here for you and we want to support you. It is never a failure. There's no failing here. It is always advised in a lot of, I would encourage people to reach out, because there's so many people struggling with this, and we know that. You're never going to be judged by me or the support systems that you probably will put in place. And that's the other thing. If you're having a hard time finding a support system, if you're worried because past therapeutic experiences have been tough, which is so common, unfortunately, make a list of what you want in a provider, what you want in a therapist or a psychiatrist or a practitioner, and write your questions down. I encourage my clients to do this all the time when they're looking for a doctor, because there's been so much invalidation in their environments in the past. Oh, you don't need therapy, or you don't need to go to you don't need another psychiatrist appointment, you're fine. Those things can really take a toll and make you confused. So write down what you want and bring it with you. If you're going face to face, like you're on a phone call and you're doing a consultation, make sure to ask those questions, because I want you to feel comfortable with your provider, and they want that too. The right provider doesn't want to make you feel uncomfortable, and they'd be willing to stay on the phone and answer those questions.
Thank you so much. I really appreciate you being with us today, Emily.
Yeah. Thanks for having me.
So that concludes our Facebook Live for today. For trusted and detailed information on all aspects of depression, symptoms, treatments, self-help tools, and more, I hope you'll visit HealthyPlace.com. I'm Natasha Tracy, and we will be back in 2 weeks with another Facebook Live. I hope to see you then. Have a great day.